Dr. Kadlec, now you're recognized for 5 minutes.
Thank you, Chairwoman DeGette, Ranking Member Guthrie, and distinguished members of the subcommittee. Thank you for your continued commitment to flu preparedness and the opportunity to testify on our efforts to develop and rapidly manufacture effective medical countermeasures to treat influenza. As noted, influenza is a serious threat to human health and poses a significant national security risk. Annually, seasonal flu leads to hundreds of thousands of hospitalizations, tens of thousands of deaths, and costs $30 billion a year in lost productivity and healthcare costs. An influenza pandemic would be even worse, killing hundreds of thousands of Americans, costing up to $3.8 trillion. Mitigating both seasonal and pandemic influenza is critical to saving lives, protecting Americans, and reducing the economic and healthcare burdens that result. Before going further, I want to take a moment to thank you and your staff who worked on passing the Pandemic All-Hazard Preparedness and Advancing Innovation Act of 2019. It strengthens public health and readiness and healthcare readiness, bolsters response and recovery programs, and increases transparency. Specific and relevant to this hearing, it authorized an annual appropriation for pandemic influenza that will ultimately enhance the confidence of private partners to invest in research, development, and manufacturing activities. We also appreciate the past congressional supplemental appropriations for pandemic influenza preparedness. With the 2005, 6, and 2009 supplemental appropriations, we invested in new vaccines, antivirals, domestic manufacturing, and enhanced stockpiling. Continued effort and support and funding remains critical, however. ASPR's role in pandemic influenza preparedness is defined in multiple policy documents. The 2017 HHS Pandemic Influenza Plan outlines ASPR's initiatives to prevent, control, and mitigate the effects of the influenza virus to humans. More recently, in September of this year, the White House released an executive order on pandemic influenza preparedness. This EO identifies specific activities, many of which ASPR is already supporting with BARDA to strengthen preparedness efforts. Turning to preparedness initiatives, thanks to BARDA's investments, we've supported the development and approval of 23 influenza-related vaccines, antiviral drugs and devices, and diagnostics. An influenza pandemic poses a significant threat to national security that could result in a significant loss of life, negatively impact the economy, and place a tremendous strain on our healthcare infrastructure.
Dr. Kadlec, what keeps you up at night when you think about preparedness for the next big flu outbreak?
Pardon me. Thank you, ma'am. I appreciate the question. I mean, I sleep like a baby. I wake up every 2 hours screaming.
Like me.
Yeah. But I think the key thing here is a pandemic. Quite frankly, I have the unique background on this committee or this dais to have served 2 years on the Senate Intelligence Committee and looked at the many threats that face the United States, but there is no singular threat that could devastate our country through our health and our economy and our social institutions than pandemic influenza.
Yeah.
And we had 4 during the last century, and even though we've had a mild one in this first century, I think the risk is that we'll have another severe one, and that would devastate our country.